Say more part. Hi, my name is Lydia Timms. I'm a student physical therapist at Anderson University. I'm going to be working with you today. Is that all right? Great. So what we're going to be doing today is something called an abdominal exam. And what that is basically examining the abdominal region using a couple different techniques. We're going to be listening with our stethoscope. We're going to be percussing, which is kind of a light tapping over the area, and then palpating, which is just using my hands, trying to feel around for some of those organs and make sure that everything is kind of where it's supposed to be and kind of appropriately sized. Does that make sense? Is that something you are comfortable doing? Before we get started, do you need to go to the restroom? Okay, and what would you like to be called?
Samuels.
Okay, so Samuel, what I'm going to have you do is lay back for me and take off your shirt if you don't mind. Alrighty, so the first thing that we're going to be doing is just a visual inspection. And what I'm looking for here is any type of bruising or scarring, any hernias that might be present, and kind of any pulsating masses that we need to be concerned about. So just from looking here, I don't see any of those things, and I would say that visual inspection looks normal and good. So the next thing we're going to be doing is auscultating. And what I'm going to be doing with that is just listening with my stethoscope and listening in all 4 quadrants to try and hear bowel sounds. Okay? Great, so I heard vowel sounds in all 4 quadrants, and so that is a good finding. Okay, so the next thing we're going to be doing is percussion, and what that is basically, like I said, the light tapping around in each of the 4 quadrants of the abdomen, and then we'll use this technique to try and measure the liver size, but what we're really looking for is a comparison between a tympanic sound, which is typically when you're percussing over air-filled sounds, it's a lighter sound, versus a dull sound, which is when you're percussing over something more dense, like a rib or a liver. Okay, so we'll just start with this. Okay, so we heard a tympanic sound in all 4 regions, which is normal because most of the structures in the abdominal region are mainly air-filled. So what we're going to do now is measure for the liver size. So I'm going to come over to the mid-clavicular line in line with the belly button and percuss upwards till we hear a shift in sound between the tympanic and a duller sound. Okay, so we hear this dull sound. Then we're going to come and palpate in between the ribs to try and hear that dull sound again. Okay, so we hear that dull sound, and if we had a skin marker that might be helpful, but we're going to measure approximately the width. And it looks to be about 8 centimeters, which is normal for your age and gender. So good job. The next thing we're going to be doing is percussing over the costovertebral angle. So what we're going to be doing is coming and finding the 12th rib and then coming across to the spine, and that kind of makes our vertebral angle. And what we're going to be doing is percussing over it. So I'll just take the ulnar side of my hand and percuss on top of it. Did you have any tenderness with that? Okay, so that's a good sign, because if there was tenderness in that area, that can be indicative of kidney inflammation or infection. Okay, the next thing we're going to be doing is palpation. And so what I'm going to do is I'm going to start out with some light palpation in each of the 4 quadrants. And this is just using the pads of my finger to try and get the patient used to my touch, the temperature of my hands, and hopefully help them to relax. So then I'm going to move to deeper palpation. what we're doing in the right upper quadrant here is we're really feeling for the liver. Sam, if you don't mind taking a deep breath in for me, and kind of sneak my hands up, you can let it out. And under that rib cage, try and feel the anterior surface and the border of the rib. I can also do this by hooking my fingers under. Sam, will take a deep breath for me if you don't mind. And doing the same thing with my fingers under and feeling the border and surface of the liver. In the left upper quadrant, what we're really going to be feeling for here is the stomach. The spleen is also in this quadrant, but we should not be able to feel it unless it is enlarged. So that's mainly what we're feeling for here. In the left lower quadrant, we're mainly feeling for the colon, and there can be some tenderness here, but it shouldn't be anything uncomfortable, just a little bit of tenderness. Do you have any tenderness with that? Okay. And then the next quadrant is the right lower quadrant, and mainly what we're looking for here is going from the ASIS to the belly button and going 2/3 of the way in between there and trying to palpate McBurney's point. And if there is tenderness in that area, then that can be indicative of appendicitis. The last thing we're going to be doing is palpating for the borders of the abdominal aorta. So if you don't mind taking a deep breath in and then letting it out for me. I'm going to press in until I can find the borders. Okay, I'm going to find them on the other side. And then measure that distance. Once again, a skin marker would be probably much more beneficial here, but measuring, we're at just over or just under 2.5 centimeters. So normal is 3 centimeters. So that would be a normal sized abdominal aorta. Okay, the next thing we're going to be doing are some special tests. And so the first one we're going to be doing is Murphy sign, and what that is testing for is inflammation of the gallbladder or cholecystitis. So what I'm going to do is I'm going to have the patient breathe in, and I'm going to be pushing down. And if you can let it out, if when he is breathing in and I'm pushing down, if he has pain that causes him to stop breathing in, stop inspiration, then that can be a positive Murphy sign, and that means that there could be some problems with his gallbladder. The next ones I'm going to be doing are all dealing with appendicitis. So the next one is Rovsing sign, and what that is pressing down in the left lower quadrant, and if palpating deeply here causes pain in the right lower quadrant, then that can be indicative of appendicitis. The next one is the obturator sign, and what that is I have the patient flex the knee to 90 degrees, flex the hip to 90 degrees, and internally rotate the knee, the hip, and if that causes pain, then that can be a sign of appendicitis as well. And then the last one is if he has his hip flexed and knee flexed, and I'm going to have you push against my hand, and if that causes pain, that's a positive psoas sign. And those last three were all indicative of appendicitis. All right, Mr. Clark, that wraps up your abdominal exam. Do you have any questions for me about what we did today? All right, well, it's very nice meeting you, and I look forward to working with you again. Thanks.